I'm with Texas Well and Healthy, and I am here to say Texas Medicaid Matters. Not only does Texas Medicaid Matters, Texas Medicaid works. It works for the millions of Texas kids who rely on it for their health care every year. Texas Medicaid Matters for the people, the Texans with disabilities who are living in their communities today. Texas Medicaid Matters for the seniors who are being cared for, just like they cared for us. And most of all, Texas Medicaid Matters for the millions of Texans who are waiting for health care coverage and who are waiting for action now. You know, for years, Texas has worked hard to connect more kids to Medicaid and CHIP, and we've been doing a good job. It's been going up every year, that's great. But we're still the highest rate of uninsured kids in the country. We're still the highest uninsured rate of Texans, or of anybody in the country. 1 in 4 of us has no health coverage. We have the opportunity today and over the next couple of months to strengthen something we know makes a difference in all of our lives. Now, we have people here from all over this great state of Texas. We have buses in from Dallas, Fort Worth, Corpus Christi, McAllen, Brownsville, San Antonio. We have people from Austin. We have people from all 4 corners of this state. And we are here with a message. What is that message? Texas Medicaid matters. We need to make this investment now, and you guys are all here to make sure that everybody in that pink building behind me know it. So, without further ado, we have a very full program ahead of us this morning. I would like Ms. DeAnn Dunkelberg to come on up to the mic and get us started.
And Kathy Cranston, get up here, you're about to talk. Hi, I'm Ann Dunkelberg, and I work for Medicaid through the Center for Public Policy Priorities here in Austin, but I'm here to help kick off this round of speakers with someone who's been a hero and a treasure to Texas Medicaid and to me for many years, whether you know her or not. DeAnn Friedholm is a Texas native, and she helped move Texas Medicaid forward, going all the way back to Governor Mark White, Lieutenant Governor Bullock, and then she was our Texas Medicaid Director under Governor Ann Richards. She's moved the cause forward for the March of Dimes, the Children's Defense Fund, and she even helped South Africa set up their systems for citizens with disabilities there. Today, she directs the health reform work for Consumers Union. You know them, they publish consumer reports. I'm so honored to introduce her. Please give a big Texas Medicaid Matters welcome to DeAnn.
Hello, fellow Texans. Thank you for being here with us today for a really important thing. Today, we are going to be doing what citizens can and must do in our government, in our democracy, and that is to participate in the decisions of our government. And I really thank you for being here. We're here today because we've got a problem. It's a problem in our great state in particular, and it's been long ignored. And now there is a viable way to meet that need, to solve that problem. And it's all about people who need to get medical care. Yeah. Medical care. Yeah. So here's the deal. Many in this Capitol either don't understand, or worse, they understand and they don't care. And we need to be sure that lawmakers understand the need and the real solution before us. And we need to make it absolutely unacceptable, morally and politically, for them to do nothing. So what is the problem? Now, in America, you're supposed to get your health care through your work. If you can't work, then some of us get Medicaid, although in Texas, hardly any non-disabled adults can qualify today. So for the vast majority of folks under the age of 65, The premise is that if we work, we should get our health care. But there's a catch, and most of us here already know it, because it's not always true in Texas. Millions and millions of people work. They're working full-time, they're working part-time, they're working full year, they're working part year. Sometimes they're working 2 part-time jobs. They work for restaurants and for big box stores and for construction and for retail and for landscaping and auto repairs and hair salons and thousands of other small businesses. But their jobs don't offer health insurance. Or if they do offer something, it's so skimpy that it's not even worth the paper that it's printed on. So in Texas, that ends up leaving millions and millions of people who work, but they don't get any medical coverage. Now, Obamacare does 3 things to try to address this. First of all, it gets big employers to chip in by providing or paying part of the cost of their workers' health insurance. The second thing it does is it allows small businesses and families to shop in these new marketplaces where they can purchase insurance at a discounted price. And third, it makes Medicaid available to cover folks with incomes below 138% of poverty. Now, what is 138% of poverty? That is, for a family of 3, $27,000 a year. A family of 3 with incomes less than $27,000 a year. And in that state, that's between 1 and 2 million people. So here's the thing. We can expand Medicaid, paid for 100% with federal funds for the first 3 years. And then, after those 3 years, for never more than 10% of the cost, with the feds picking up at least 90% from then on. So what that means is over the next 10 years, we can cover millions of Texans, get $100 billion from the feds if we spend $15 billion in state funds. That's going to cover over 1 million. We spend 15 million, we get 100 million, we cover over 1 million Texans. That, my friends, is a really good deal. So why wouldn't we do this? What's the question? Why can't we do this? Well, there are people who say that Medicaid is broken, that Texas needs flexibility to fix it. And let me suggest to you that we should not get sidetracked on that point. Because can Medicaid be better? Sure it can be better. Absolutely, it can. But I can tell you, as a former Medicaid director, that the biggest problem with Texas Medicaid today is that the payments for doctors are so far behind what other medical programs and insurers pay that doctors can't or won't take Medicaid patients. That is the biggest problem that we have. There are other problems, but that's the big one. But guess who is in charge of setting provider rates? The Texas legislature. So that's a red herring, friends. Texas is blaming the federal government for something that they are responsible for. Now, the second thing that they say, the second reason they say we can't do it is we can't afford it. But friends, we cannot afford not to do this. Because you know what? We are already paying for it. We're paying for it with sicker people, with less productivity, with higher property taxes, and higher private insurance premiums. We are already paying for this. And instead, what we could do is expand Medicaid, protect it, expand it, pay for it up front to help people stay healthy, or we can pay for it later like we're doing now when it costs a lot more in dollars and in needless suffering. It's also true that when the state of Texas had been booming, even when we've had good times, I've been around here for over 40 years working on this stuff, bad times and good, even the boom times, we've still had the highest percentage of uninsured people in the country. In the richest of times or in the poorest of times, two things seem to have been true. One, millions of Texans get up every day without health insurance and face one accident or one illness from destroying their family's health care and their financial security. And two, many of our lawmakers seem to think that this is okay, that they have no obligation to make available medical insurance to those uninsured Texans, the vast majority of whom are getting up and going to work every day. This can be different. We must do everything we can to get them to act now, this session. Because here's the real bottom line. Here's the real bottom line. Healthcare needs are the same, whether you're a millionaire or a minimum wage worker or someone who's lost their job and looking for work. Healthcare needs are the same. We need preventive checkups. We need to be able to see a doctor when we're sick. We need to get medicine for our chronic illnesses like high blood pressure or diabetes. And God forbid, when your child or my child, your spouse, my spouse, or God forbid ourselves get told that we are really sick, like with cancer or a stroke or Parkinson's or many other serious illnesses, then we and they need to be able to get the great medical care that this country has to offer. That is what this is about today. Medical needs are the same, and it is time, and the answer is now within reach. The last time we had the Texas Medical Association and the Texas Hospital Association and the big chambers of commerce and the city and the county governments and community health centers and over 40 other state and local organizations coming together to say to the legislature and the governor, do this, was when we passed the Children's Health Insurance Program over a decade ago. And we passed a really good program. So it is time. We can do this. Governors of all political stripes across America have figured out that this is a good deal for their states. Even if they don't like Obamacare, it is a good deal for their states. Finally, in the paper this morning it said that the Federal Department of Health and Human Services has said they're open to discussing options with Texas. This can be done, friends. We can do this. So today, as each of you go inside these doors and you see your senators and you see your representatives and you talk to the governor or his staff, let them know it is time to protect and expand Medicaid in Texas. Because it is the right thing to do, it is the moral thing to do, and it is the affordable thing to do. Texas Medicaid matters. Thank you.